Think about this for a second. There are two worlds. In one, a long, healthy life is pretty much a given. But in the other, your shot at survival is basically decided the moment you're born. Today, we're going to get into why your place birth can be the single biggest factor in your health. And that's really the big question we have to ask ourselves, isn't it? Why should the lottery of where you're born determine whether you live or die from something that is completely preventable? It's a massive injustice, and it's right at the heart of what we're talking about today. So, there's a name for this. It's called health inequities. And here's the key thing to remember. These aren't just random differences in health. They are avoidable, they are unfair, and they're baked right into the systems that run our world. This isn't a problem of nature, it's a problem of justice.
And it's so important to be clear about what we're aiming for. It's not about equality, giving every single person the exact same thing. It's about equity. It's about giving people the specific support they need to have a fair shot at a healthy life. The goal isn't sameness. The goal is justice.
Okay, so how on earth did we get here? These huge gaps in health, they didn't just appear out of nowhere. To really get what's happening now, we have to look back into the past. If you go back to the colonial era, a lot of health systems were built to serve just a tiny group of elites, not the general public. So right from the start, they were designed to exclude people. Then, after independence, new borders were drawn that often created a ton of instability. And then more recently, in the late 20th century, huge international debt forced a lot of these countries to slash their spending on public health. So the fragile systems we see today, they're a direct result of all this history. And all of that history, well, it brings us right here to the present day. So let's actually dissect the anatomy of this inequity. How do these barriers actually show up in people's everyday lives? A really good way to understand this is something called the 5 A's of access. Think of it like a series of hurdles. First, is care even available? Are there any doctors or clinics? Then, is it accessible? Can you physically get there? Third, affordability. Can you actually pay for it without going broke? Then there's adequacy. Do they even have the right medicine and tools? And finally, acceptability. Does the care you get actually respect your culture and your needs? If you fail at any one of these, it can literally be the difference between life and death. So what's the real human cost of these barriers? Just look at this number. A woman in sub-Saharan Africa is about 100 times more likely to die from complications in childbirth than a woman in a high-income country. 100 times. Let that sink in. This isn't just a statistic, it's a tragedy playing out every single day. And this chart just drives the point home. It shows that over 90% of all deaths from malaria and from childbirth complications happen in low and middle-income countries. These are preventable deaths, and the burden is falling almost entirely on the parts of the world with the fewest resources. Now, as if all that wasn't enough, many of these already struggling health systems are dealing with something called a double burden. It's like they're being forced to fight a war on 2 separate fronts. So what are these 2 fronts? Well, on one side, you've got the old burden. That's the long, hard fight against infectious diseases, things like HIV, TB, and malaria. But at the same time, they're dealing with a new burden, a huge rise in chronic diseases like diabetes, cancer, and heart disease, the kinds of illnesses we usually associate with wealthier countries. And the result is exactly what you'd think. These health systems, already underfunded and understaffed, are just completely overwhelmed. They're trying to fight 2 totally different health crises at the very same time, but with just a fraction of the resources. It's an almost impossible situation. Okay, that's a lot, and it can feel pretty bleak. But there is hope. Understanding the problem is the first and most important step. So now, let's explore what a blueprint for health justice could actually look like. The solution here can't be just one thing. It's not just about building more hospitals. It really takes a 3-pronged approach. At the systemic level, we need to strengthen health systems with big goals like universal health coverage. On a social level, we have to tackle the root causes, things like investing in girls' education and clean water. And at a foundational level, we have to decolonize global health. That means shifting power and funding to local leaders and organizations who actually know their communities best. And we know this kind of approach can work. Rwanda is an incredible example. After their horrific genocide in 1994, the country rebuilt its health system from scratch. They rolled out community-based health insurance, they empowered local health workers, and what happened? Maternal mortality plummeted. They tackled the exact kind of inequity we're talking about head-on. Or look at Brazil's family health strategy. This was a huge nationwide commitment to put teams of doctors and nurses right into neighborhoods. By literally bringing healthcare to people's doorsteps, they reached millions. And the results were amazing. Huge drops in infant mortality and way better vaccination rates. These examples show that real, ambitious change is absolutely possible.
You know, we hear all the time that a nation's wealth is in its people's health. But maybe a better way to look at it is this: the justice of our world is reflected in the health of its most vulnerable people. At the end of the day, this is about way more than just healthcare. It's a measure of our shared humanity.
And this isn't just a problem for governments or big organizations to solve. It really comes down to a question for each of us. What role can we, as citizens, as policymakers, as advocates, play in closing this gap and creating a world where a healthy life is a fundamental human right, not just a lucky draw at birth? Thanks for joining me.